Well, good morning, everyone. Thank you so much for joining the LeadingAge Virginia member call. Today, we have quite a few issues to discuss. We are going to begin with Corey Calhoun from LeadingAge National to talk with us about some burning questions that we've been receiving and issues related to vaccine and mask mandates. After that, we're going to enter into a little bit of a member discussion about how members are handling this in their communities. And then we'll provide a brief overview from the General Assembly session, talk a little bit about some recent developments with the temporary nurse aid program, and some discussion on that. So with that said, I'd like to hand it over to Corey, who's going to recap a little bit from our last call and talk with us about what's happening in the area of the vaccine mandate as well as mask mandates. So thanks, Corey, for joining us. Over to you.
All right. Thanks, Dana. And, some things have changed since the last time we talked about this a couple of weeks ago. I think on the vaccine mandate side, we've seen more states jump on and issue mandatory vaccines for healthcare workers and or long-term care workers. I think shortly after our call, Massachusetts, I think Connecticut, California had a mandate for state employees in the healthcare arena, and now they've expanded that as well. And so that was that's kind of been the big change. And so is my camera on, Dana?
No, it's not. If you could turn it on, that'd be great. Thank you.
No, it's on, Corey. I can see you.
Okay.
Oh, I can't. Okay.
All right. And so we've seen I don't want to say a snowball, but we've seen a few more states kind of come on board. And in addition to that, we did a survey of our memberships, and we're seeing on a whole on the nationwide level, and we're seeing more and more folks issue vaccine mandates as we go forward, and then we have a couple of states where vaccine mandates are prohibited at the time. So I'd say all in all, they are moving along, and I think that they're, from what I've heard and other calls that I've been on, they're experiencing the same or similar impact that we discussed on our call a couple of weeks ago. And so the staff turnover and losing staff has been about the 1% to 3%. They're not getting as many requests for reasonable accommodations and or exemptions as they anticipated, and so things are moving along in that sense. I think the main reason that folks are still holding back is the workforce issue. There is a lot of fear of losing workforce, and so I think that is the main driver of what is holding some people back for sure at this point. As far as mask mandates, we are seeing this varies widely state to state. And so a lot of states are really hesitant about putting a mask mandate in. And the area where we're seeing mask mandates, and the biggest area and contention is with schools. And I think, the more mask mandates you have in schools, I think the less spread you'll have in school, the less potential you'll have to bring home. And especially with our staff, where they've got school-age children, I think they're really at risk if there's a lot of spread amongst the community in the schools. And so those are things that we're monitoring. But that, at this point, this is still such a political and contentious issue in most places that we're seeing a lot of these things go both ways in this sense. Now, you as private employers obviously have the ability to issue whatever mask mandate you want to have for visitors and all the like. Obviously you have to follow the state and the federal CDC and CMS guidance on that, but we're still seeing a lot of the contentious spots, especially in the schools and or other public places. So that's where we're at on mask mandates. I think the federal mask mandates on the transportation side for planes and trains is going to get extended through January. And so, that's kind of the direction that we're heading as we're all following the latest update on cases and the Delta variant. So I'd be happy to answer any questions that folks have. But that's kind of a little overview. We're a little further down the road as far as more folks with mandates, but yet we haven't quite reached the tipping point. I also think that on the flip side of that, we're seeing, I think, vaccination rates go up, especially in some of those areas that have been really hard hit by Delta. And I think we'll see more and more of that information and data coming out as well. And so hopefully that'll translate into areas that haven't quite had a big swell of the Delta yet, but I think that'll hopefully spur enough people or more additional people to get vaccinated as well. Dana, do you have some specific questions too? Oops, I think you're on mute still, Dana.
I'm sorry, it's my day of bloopers. Yeah, I just, it's encouraging to hear that the percentage of staff leaving communities with the vaccine mandate is relatively low. And that's what we're hearing is the trend in Virginia. I think it might be, we're not seeing any questions in the chat box now. It might be a good opportunity for us to segue to some of the discussion with their members about what they're doing, and maybe that could trigger some questions. But before we move on to them, I would like to, open it up now and see if there are any questions in the chat box. Anyone has anything to add? Okay, Corey, well, I'm not seeing any, but I think that we probably will have some additional ones. So I'd like to give it over to Anita Atkins with Westminster Canterbury Richmond, who's going to talk with us a little bit about how they're handling this in their community.
Thanks, Dana. Yeah, I'm happy to share about our experiences, and it's certainly in line with what Corey has shared. Some of you may know that in mid-June, we announced that we were going to ask all employees to be required to be fully vaccinated by September 1st, of course, unless they have health or religious reasons that would keep them from being vaccinated. So at that time, we were already a little ahead of, I think, where the industry was. We had about 75% of our staff fully vaccinated. So here we are a couple of weeks out from our deadline, and we are at around 86% of employees who are fully vaccinated. We've had 2 religious and 4 medical accommodations, but only 5 resignations that we know are due to us putting that requirement in place. I think LeadingAge Virginia has already shared some of the written materials that we were using as we were educating staff and the forms that we put into place. But in addition to that, in talking with our HR team that's been working so hard on this, there's just been a lot of one-on-one conversations with people to try to understand their reasons for not being vaccinated. Not all of it is political. A lot of people are just scared. And so having a conversation with a clinical person who they trust and respect has sometimes been what would make the difference in getting them to go ahead and get vaccinated. We've also been trying to help them understand, people who are in this industry are often there because they care about the people that we're working for. And so helping them understand that because we're caring for that vulnerable population, we have a really valid business reason for requiring vaccination. So that's been persuasive for some people. In terms of masking, on July 1st, we had allowed fully vaccinated staff the option to stop wearing a mask in the building. We had already done away with that for our residents and our visitors, of course, except for in our healthcare areas and our child development center. But at the end of July, when the CDC updated its guidance again, we started monitoring the transmission rates. And so when it reached those substantial and high levels again, we did start requiring masks for staff and for visitors in all areas of the campus. We're not requiring it for residents, but we are still doing a lot of education and recommending that our residents consider wearing a mask in our community, and then also educating them that it's not a bad idea to do it when they're off campus out in the broader community, just to give them that additional protection. Also around the end of July, we started to see some breakthrough cases of COVID-19 in our fully vaccinated staff. We've had about 6 so far, but thankfully those came as a result of travel or visiting with family, so it hasn't exposed or impacted our residents so far, and we certainly hope that it stays that way. But because we were seeing those cases and the increase in transmission rates, we did put back into place the requirement that our staff, when they return from travel away from home, we're keeping it kind of vague, we are asking them to be tested when they return. And so we're including everything from just kind of being away from home just for the day, even if somebody say goes to Busch Gardens or something like that, in addition to travel further away or on public transportation. Even if they don't have any symptoms, we just want to test them when they come back, just so that we can try to catch any of those breakthrough cases and keep it from impacting the community. In addition to that, we have continued to reopen our programming. As of this week, we're allowing outside guests in our dining rooms. We're going to let them attend theater performances and pastoral care events, things like that. And we're just kind of monitoring it. I know in dining, some of our residents have been really happy about inviting their family and visitors to dine with them. So we've seen a bit of an uptick, but we're only on day 3. So I'm not sure if people are taking full advantage of that yet. Time will tell. And certainly some of our other programming, like our theater, once we had to start talking about the variant and putting the mask mandate back in place for staff, we did see a drop off in some of our attendance numbers in those areas. But we hope to keep the programming open for those who feel comfortable. Our messaging has just been that, we're keeping an eye on it. We're going to keep trying to stay safe. But at this time, we're not making any changes to that, and just kind of taking it day by day, week by week. So that's what I've got. Do you have any questions for me?
Yeah, thank you, Anita. We have a question in the chat box, but before we go there, I just wanted to give everybody an opportunity if they could put in the chat box if their community has a mandate in place for the vaccine and or the mask. If you could just let us know while Anita's talking, that would be great. If you could put your community name and what your policy is. Yeah, and we do have a question that's come in. What are some examples of religious exemptions that you are allowing? In this particular case, the community is getting a variety of requests with very heartfelt reasons.
Yeah, that's a great question. I did talk with our HR team about that, since I'm not directly involved in those conversations. And like I said, we've only had 2. And so I think we were a little surprised that we weren't getting more requests for that. But it sounds like they have been, fairly direct, and it's not really something that we're able to ask a lot of questions about, to my understanding. So we haven't seen a lot of that. And then, of course, the medical exemptions are a little more cut and dry. So I'm not sure what others have been experiencing with that.
Thank you. One follow-up question. You're inviting visitors and families to dine with residents. Any concern over viral exposure being brought into the community?
Yeah, that's a great question. Certainly there's still some risk with that. We decided that we would continue to move forward with that because we have 98.5% of our residents are vaccinated. And since we are requiring those masks when people are in the public areas as they make their way to the tables, we're limiting the numbers of people who are able to come in and dine, keeping it to parties of 2 or 4. So there hasn't been a ton of use of that yet, but we wanted our residents to be able to get back to having their families around. So we're giving it a try and going to see how it goes, and certainly we'll adjust if we have to. Dana, I think you're on mute.
Anita, how are you tracking your staff that are going away for particularly like at Busch Gardens or whatnot? How are you tracking that to ensure that testing occurs following that?
We're relying on education, and it's part of our employee policy related to everything that we've put into place with coronavirus, and lots of education with our management team, because they generally know where their team members are going, and then asking them to make those appointments upon return. So kind of relying on that education and keeping people accountable to what those requirements are in our policies.
Great. Thank you so much. Melissa, I think you had a question for Corey. All right, we can come back to that one. Thank you, Anita. I wanted
Yeah, I was just hoping you would read it.
Oh,
Oh.
sorry, I was on mute too. I was starting to answer it. So I guess Melissa's question, if they don't have a religious exemption for any other vaccine, can they try and use one for the COVID vaccine? In other words, if they get the flu vaccine without exemption, would this be different? And that's a great question, because when you look at the exemption on the religious side, it has to be I think one of the comments was we're seeing a lot of heartfelt reasons and exemptions. But when you look at the religious exemption, it has to be a sincerely held religious belief. Okay. And so there has to be a religious component. So it has to be tied to a tenet of a religion that they participate in. And so that is the distinction, I think. And I agree with Melissa. If they haven't had a really sincerely held religious belief for other vaccines or shots, it might be really tricky to then all of a sudden claim a sincerely held religious belief regarding specifically the COVID-19 vaccine or shot. And so I think that's where you have to really look at tying it back to a sincerely held religious belief. And so that's I think the key when you analyze those. And, frankly, I've seen others that have asked for confirmation from some sort of clergy and or other participant within the same religion. And I think that's one way to kind of double check and see if this is a sincerely held religious belief, to make sure it's actually shared by somebody else within that religion.
Thanks, Corey. And thank you, Anita, for your perspective about what Westminster Canterbury Richmond is doing and sharing your policies in place. And we have those on our website. I put that in the chat box for anyone who wanted to review Westminster Canterbury Richmond's policies and access them. So Rebecca Morales at Bechalon Village, could you share a little bit with us about how you're handling the increase?
Sure. I wanted to kind of touch on what Corey just mentioned as far as the religious beliefs. We did just that. We did request from clergy for one of our employees. We only have one employee that did request a religious belief exemption. We have 4 employees that are exempt out of all of our staff. We're right at 99% vaccination rate. We did the mandate effective July 1st. And out of that, 3 employees were exempt for medical reasons and 1 for the religious belief exemption. I did pull this employee in and educated the religious belief exemption and let them know the research that I had and let them know that they had a certain amount of time to bring back a letter on this specific religion's, their company's letterhead, signed, dated before the July deadline, indicating that this is their belief process and that they were in agreement that he should not receive the vaccine. With that being said, anyone that is exempt medical or religious belief-wise, they are tested and they have to wear a face shield and a mask while they're working, whether they are in an office or whether they're on the floor with direct patient care. So that is how we're dealing with our exempt staff at this moment. So we have 4 staff that are exempt. So I did want to pick up there. And I'm sorry, I didn't hear everything that Anita spoke about. I was having some technical difficulties logging in. So I do apologize for that. I don't really want to repeat everything that was said. But I did hear the tail end of what she was discussing about dining with their families. We still don't allow that because of the increased risk of transmission. We feel as if we are still requiring the social distancing in the dining room. We went back to that whenever we went, whenever we saw the increased the rise. We went back to that. So that has not been implemented yet. I know it's difficult, but we are still encouraging the social distancing. We're still requiring family members, visitors to wear a face shield whenever they enter, along with a face mask. That's just extra protection for everyone that's in the building, including our staff. And we're just educating every time we have resident council. I'm in there educating the residents as to why we're doing this. And they really appreciate although it's difficult for them, they can still see their loved ones. They understand they can still do all of the visitation, the families can still come in to visit. They can still have that sense of connection, but we don't want to increase the risk of an outbreak where we have to go on a lockdown scenario, which really causes the isolation situation to set in, which is so hard on everyone. So they understand why we're being so proactive. They appreciate this type of proactiveness that we're taking, and that's the feedback that I get from them. Is there anything that I need to hit on that Anita may not have hit on?
Well, Rebecca, I have a question. Have you had any response from surveyors, from the assisted living or nursing home surveyors regarding any protocols or anything that you've put back in place? Have there been any feedback?
No, we have not had any surveyors in the building or any calls on anything. I think we communicate everything either in letter format or email format, actually both. We have postings on our doors. We continue to have a door screener at the door. We have one entrance to the facility still. We continue to be very vigilant in our processes to keep everybody safe.
So I would ask Anita, has there been any response from surveyors, any input, feedback?
Nothing that I'm aware of, no.
Okay, great. Thank you. I do not see any questions in the chat box, but I would like to open it up if anyone who would like to come off of mute to ask Anita or Rebecca or Corey any questions. Corey, based on anything that Anita and Rebecca have said, was there anything that you wanted to add any additional comment on?
No, I think that Anita and Rebecca's experience is representative of what we've seen with folks that have initiated a mandate. It's going to be a little unique to your each community, but on the whole, I think their experiences are pretty representative of what we've seen as far as success. And in addition, that even when you've got the vaccine mandate, you still have a lot of other issues you still need to worry about, especially with the breakthrough infections that we're seeing, the mask mandates, and the evolving scenario that's in your broader community. And so I think we're used to that, but I think that that's kind of what we're seeing and hopefully should kind of be the guideposts moving forward.
Hey, Dana, I just wanted to jump in and share that we had our monthly collaborative association call yesterday where we talked to the other long-term care associations and the hospital association. And the hospital association shared that more Virginia hospital systems are going to start mandating this. We had a really nice conversation around leveling the playing field, right? The more providers that mandate, the less risk of losing your staff, because there won't be any place, at least in healthcare, for them to go. So just want members to know, particularly in Northern Virginia, that there's a system up there that's going to enforce a mandate. And the hospital association continues to try and support their members in that arena, trying to get them to do this as well. So for those members who are worried about, the competition for workforce, this is evolving and there are more and more companies and businesses that are starting to mandate. I'll also just add that I was on a call that Corey was probably on yesterday with the state execs from around the country. And despite where we are, we're really lucky here in Virginia when you hear the stories of what's happening in Oklahoma and Kansas, communities that have one nurse on staff who doesn't want the vaccine. And so they're terrified to mandate. There's communities with 100% agency staff in them. These are bedrock not-for-profit communities, and they're having huge outbreaks in the South. So as uncomfortable as many of us are with where we are, somebody asked me last week how I was, and I said bitter and angry. And I wouldn't be surprised if some of you feel that way too, although you're much more resilient than I am. But I think that you're all doing the right thing, and I just want to applaud you for that. And I think when you have a second, say some prayers for our sister and brother providers in LeadingAge National and other states where they've just got a lot of issues, and we're so blessed not to have those as of now. So just some perspective for everybody.
Thanks, Melissa. Appreciate that. As we move on to the next topic, which was what happened at the General Assembly, I would like to encourage you to put your questions in the chat box for Rebecca, Anita, and Corey for those that come up. And also, if you've not let us know about your community as to whether you have a vaccine mandate and/or mask mandate, please put that in the chat box. We would really appreciate having that information. We'll summarize it, and then we'll share it with the members after our call today. So the Virginia General Assembly recessed on August 10th. They came together to really discuss and determine the allocation of the American Rescue Plan Act funds, as well as elect judges. So I have two main highlights that really are affecting long-term care that came out of the General Assembly. Of course, I just want to thank everybody for your advocacy for funding for long-term care, for a specialized COVID return to work fund, and so forth. We did have some funding that was allocated. It's not what we hoped for, but we have funding that has been set aside for nursing homes to be reimbursed $5 per Medicaid resident day. That will run from July 1st to June 30th of 2022. We're not certain at this time yet what documentation or process requirements will be in place for nursing homes to receive that funding. We're continuing to work with the Department of Medical Assistance Services to make that determination. So we'll keep you informed about that. The good news is that we were very encouraged that one of our requests to be able to extend the Board of Nursing's authority to determine applications for TNAs to sit for the CNA exam has been extended. So we advocated for language to be included in the budget to extend that authority, and as long as the public health emergency is in effect, that authority has been extended. So I'm going to talk a little bit about that, but first let me check the chat box to see if there are any questions. No, I'm not seeing any. But I am going to put in the chat box, the Board of Nursing has updated information about the TNA process and what you would need to do to move forward your applications for that. So if you could go to the next slide, Paula. So LeadingAge Virginia, we have a really exciting TNA to CNA bridge program. So I am going to hand it over to Cinematic Health to talk with a little bit with you about that. But if you have any questions about temporary nurse aides, TNAs in your community, please reach out to me. This is just another pathway to deal with staffing shortages. So we're really pleased that we were able to get the Board of Nursing to be able to have that extended authority. So I'm going to pass it over to you, Chad.
All right. Thanks, Dana. And I appreciate everyone's time today. So really excited to be partnered with the team at LeadingAge Virginia to help support all of your needs as it comes to staffing shortages, which I know you're all seeing, and the extension or reintroduction of the TNA program is a very important means for facilities like yours to meet those needs. So just a quick overview. If you don't currently have TNAs, to become a TNA, it requires an 8-hour training program, which we've developed in conjunction with LeadingAge Virginia. And it's online. It's very much focused on the kind of the basic skills someone would need to be a temporary nurse aide. And we also take a unique approach with Cinematic Health, and that is to bring in story-based learning to really help someone become a TNA, but also then to move into the CNA and bridge to the CNA, to not just focus on the content they need to understand in order to test, but also to understand how to work with residents in an effective, positive manner. So we're excited, and just, so and Dana, I think there were a few other slide points.
Yes, we have another slide.
Okay, and actually, is there another one after this?
Yes, there is a second one.
So
there you go.
So thank you. So we have that temporary nurse aide program, which is 8 hours. It's great that Virginia has now outlined how to convert a TNA to a CNA. So first of all, you at your facility level need to deem them competent, and there is a form that you fill out stating as such. Once you do that, the TNA can file or fill out an application to take the NNAAP exam through Pearson VUE. And our suggestion, because the state has not really laid out much beyond the on the job training they'll have, and I think the recommendation is 80 hours, so 2 full weeks. But in order for them to be able to pass the test to convert to a CNA, they really need 2 elements. One is they need to understand the skills that they're going to have to test for. And that's something that you would do at the facility level on the job, helping them to understand the various steps that must be taken with hand washing, with transferring a patient from a bed to a wheelchair, and so on. All those skills well. And then additionally, they're going to have to take the written component. And honestly, that may be the most difficult section for a TNA to transition to the bridge. And that's where, or to transition to CNA. And that's where our TNA to bridge program that we developed with LeadingAge Virginia comes into play. And that's a 30-hour program. Like the 8 hours, it's online, it's story-based, it's highly engaging, but it really provides the training that your TNAs will need in order to pass the test. And if they have 3 attempts to pass the test, and after that, they can no longer sit for the exam. So, obviously, I think we would all want them to pass on the first go. And so providing them with the tools they need to be successful is vital. I think the other point I will make is that as we do work with bridge programs across the country, is in a number of states they're using this as a way to get staff in quickly, to get them trained affordably, so that you're able to meet your residents' needs. So bringing in a TNA today, having them work for a few weeks, get that on the job training, work on their skills with them, and then provide them with the bridge program that we're offering, I think is a way to get more staff fully trained, fully certified for you in the short term. So, Dana, I don't know if you have anything to add.
Yeah, Chad, what is, if a TNA has already undergone the 8 hours and is just interested in moving forward with the 30 hours, what is the cost per staff person to participate?
Yes, so the cost for that is $325.
And if a staff person needed to have the 8 hours TNA training, is that included in that price?
It is not. There's a $45 charge for the 8-hour course. So, reasonably priced. And the quality, I think, and I'm more than happy to meet with anyone individually to kind of walk them through and show the quality. I think that there's a reason that Dana and Melissa partnered with us because of that. So.
It's a really unique opportunity because if there is a person that's expressed an interest in becoming a CNA, this is just a really great opportunity for them to kind of enter the program in a lighter way, and then also help the community with staffing shortages.
Exactly.
Yeah, and the Board of Nursing really has no regulation over temporary nurse aides, so the scope of work is going to be up to the community and how they would process that for that particular TNA. And I know that differs from every community. Is there anybody on the phone now who is moving through this process? Rebecca, I know that you all have some folks that will be applying to sit for the CNA exam. Did you want to offer any comments on how that's working in your community?
Well, Chanel has been handling all of this. I've kind of been hands off, unfortunately. So I apologize that I don't have a lot of information on this. They are working one-on-one with our CNAs right now to get all of their hours and the skill sets that they need. So that's really all that I have to offer. I'm sorry.
Well, no, that's okay. I mean, it's really exciting because I've worked with Chanel and I know that you all have several in the pipeline that are applying. So it's just really exciting that it's moving forward and that it's working for you all.
Yeah, I believe we have 6.
Great.
Well, are there any questions around the TNA to CNA program? We do have a webinar that we did earlier this year. I put the link in. That's got a lot of information. It's a brief webinar. If you'd like to just jump on and take a look at that, that provides a lot of great information. If you're interested in moving forward with the Bridge program, you can reach out to me and I will put my email in the chat box, and then I can connect you with Cinematic Health to get that moving forward. So before we move on, I just wanted to ask if there were any questions that have come up for Corey, Anita, or Rebecca regarding the policies that they have in place in light of the increased viral activity. Okay, well, without any questions, I would like to move on to our next slide. We are really excited to announce our virtual policy symposium. This is going to happen on September 30th from 1 to 2:30, and we ask our members to participate. It is an opportunity for you to weigh in and assist LeadingAge National in developing its policy priorities for 2022. They do this throughout the country and meet with the other LeadingAge states to talk with them about the issues that are important to them. And I am going to put the registration for that. Oh, I thought I had it. I apologize. We will get that registration link out to you so that you can get the information to register for that. So we'll be sending that out shortly. That's just a really great opportunity for you to weigh in, and you don't have to leave your community. It will all be virtual. So we hope you'll participate in that. So with that said, I don't have any additional things to add. If anything comes up, any questions you have, please feel free to reach out to us. I just want to thank Corey, Anita, and Rebecca again for talking today.
Thank you.
Please let us know if you have any questions. We're here for you. Thank you, everyone. Oh, I think Melissa put that in the chat box if you need it, the symposium registration. Have a great week, everyone.